Welcome. It's California Edition. I'm Brad Pomerance, and I am in Sacramento with Senator Bill Monning. He is a member of the California State Senate, of course. And I want to speak with you about an activity many of us enjoy throughout the state of California, and that's the mere act of boating. We have lots of beautiful lakes, but there have been tragedies, and I know you had a constituent that faced a tragedy.
That's right. So one of my constituents from San Luis Obispo County lost her son, actually many years ago now, boating accident. My legislation, SB 941, would require certification of training, basic safety training.
Let's talk about, if I may, when you get a driver's license, you take a test.
That's right.
And you are actually put into a car and you drive with someone who is certified. When you ride a boat today and you are the driver of the boat, do you take a test?
No.
No. Do you go into a boat with someone to see if you know how to ride the boat?
No.
No. Why?
Well, California is only one of 5 states in our nation that does not have a boater education training requirement. So we're really behind the curve here. What's encouraging about my legislation is we have broad support from boating associations, law enforcement. We're overdue. And my bill would simply require that to operate a motorized vehicle, that could be a jet ski or a motorboat, you have to get certified that you've gone through a training program. You could do that online. You get certified once, and that's good for life. You don't have to renew it every year. And so it's a starting point.
Why shouldn't we see renewals every 5-10 years like we do with driver's licenses?
Well, we may evolve to that, but the point here is we're starting from scratch. No requirement. Boating accidents are tragic, and they can be avoided. And we just want to raise the standard of anyone who's operating a motorized vehicle is going to be able to present certification that they've got basic education in the rules of the water. We say rules of the road, this would be rules of the water.
So how will this work? Will there be a fee to take the course? Would you be taking a course?
You do a course online. You pay a fee to get the certificate, similar to certain driving tests now that you can do some of it online. There would be no in-boat requirement. We do have a provision for rentals, someone who might just be going to the lake for one day and renting a motorized vehicle. They would take a short course at the site of the rental and be certified for the purpose of that rental craft for that day.
What about kayaks or other types of vehicles that don't have a motor?
Well, fair question. So this only goes to motorized vehicles, so motorboats, jet skis, specifically does not include kayaks, canoes, rowboats. It would include craft on the ocean as well as on lakes. So we have 1,000 miles of coastline in California, a lot of marinas, and unfortunately these boating accidents happen on the ocean as well as on lakes.
And is there an enforcement mechanism?
Well, the enforcement agencies, including county sheriffs, parks, state parks, and others who have jurisdiction over waterways would have the ability to determine if somebody had certified or not, and there would be a penalty provision similar to a traffic ticket.
What are your friends saying in the boating community, for example?
Great. Well, we're very encouraged because the boating community, which is a very strong network of enthusiasts, are very supportive of this legislation. They see it from the self-interest of protecting their members. Their members are probably some of the most adept and trained and skilled boaters. They're going out on lakes or ocean ways where people are not playing by the rules.
When we come back, I'd like to speak with you about the budget, if we may. For our viewers on HLN, I thank you so much for joining us. For our other viewers, we'll be right back on California Edition. So let's speak about the budget. You are chair of one of the budget subcommittees in the Senate, is that right?
Yeah, I sit on Sub 3, Health and Human Services, and I sit on the full budget committee. So
let's talk about Health and Human Services, if I may. The governor recently issued his May revise. I was fascinated to read the section about the Affordable Care Act. So what we know about the Affordable Care Act is that signups have been going gangbusters in California, especially as it relates to the Medicaid expansion.
Correct.
But that's caused some fiscal pain because of a distinction between those that were eligible before but hadn't signed up. Explain, sir.
Exactly. So we have two categories of people eligible for Medicaid expansion. California, we call it Medi-Cal.
Right.
It is based on a means test of income. Under the Affordable Care Act reform, it raises that level to capture more people who didn't have insurance. But you put your finger on the point. We get 100% federal reimbursement for newly eligible.
Newly eligible.
But for people who were eligible but not enrolled, it's a 50-50 split. So California has to pay 50% of what is appearing to be a growing number of people who were earlier eligible but not enrolled. So that in the May revise, and about a $1.2 billion increase than what was budgeted in the January budget. So the May revise is used to kind of tweak or adjust from what was projected in January by the governor's budget to what actual revenues have been and a better sense of actual costs. So in this category, the May revise suggests that we were $1.2 billion short. So I think there'll be support for that increase. We really don't have a choice, and every dollar invested even on that side of the ledger is matched with a federal dollar. So from a healthcare perspective, that's a good investment. The problem is it reduces our flexibility with other program restoration and other safety net programs or education or whatever it might be.
Do you believe that we will actually make that money up in that folks will not be going to the emergency room and the bills won't be being sent to the state?
Well, in the long run, definitely yes.
Okay.
In the short run, in a budget year, probably too quick a turnaround to really realize that savings. But in the long run, more investment in primary care, prevention, immunizations, keeping people out of hospital emergency rooms, that will definitely inure to the benefit of all Californians over time.
Were you aware of this distinction between had been eligible but not enrolled? I mean, I thought I knew it all about the Affordable Care Act. I did not know about that distinction.
Well, and I think you're not alone.
Yes.
Most Californians, Brad, are not drilling into the weeds on this. As a member of the subcommittee on Health and Human Services, we did look at the projections, and there was some pretty robust debate about the accuracy of those projections, but it was really hard for anybody to, nobody had a crystal ball.
And I'm wondering if you've spoken with some of your colleagues in other states who are considering Medicaid expansion. I mean, at this stage, only about half the states have agreed.
Right.
This is a wrinkle.
It is a wrinkle, but it's still, if you're looking at long-term health costs and you're getting the federal government, even on these prior eligible, to pay 50%.
Is that a good deal?
It's a good deal. And for the newly eligible, and that's what states have turned down, is Medicaid expansion to newly eligible, where the federal government pays 100% for 3 years, and it will drop to 90%, where the state would have to assume up to 10%. To me, that's a bargain anywhere.
What about those previously eligible? Will it stay at the 50-50?
Yes.
Is that what the formula is?
Yes.
Before the Affordable Care Act?
That's right. So that was the formula for Medi-Cal, for Medi-Cal eligible in California. And what the federal government said in the Obama administration, with the expansion where we're raising the poverty level or the eligibility level, because we're expanding the number of people in your state who will be eligible, we'll pay 100% of that.
I want to ask about your district, a very large one on the Central Coast.
Yes.
How are signups generally in your community?
Well, they've been going gangbusters as well, but a large sector of the workforce in my area, agriculture, hospitality, tourism, if a worker is undocumented, they're not eligible under the Affordable Care Act. So we have a public health issue where we have people in our workforce paying taxes, having payroll tax withheld from their paycheck, every paycheck. They're contributing, they're paying sales tax, but they're not eligible for health care.
I'm sure you know Ricardo Lara is looking at changing that. We'll talk about that the next time you come on.
Good. I look forward to it.
Okay, his name is Bill Monning. He is a member of the California State Senate. My name is Brad Pomerance, coming to you from Sacramento on California Edition.